Understanding stomach ulcers. Open sores in your digestive system. These ulcers can cause significant discomfort and lead to more serious health issues if left untreated. Stomach ulcers are painful sores that develop in the lining of the stomach. They can cause a burning sensation, especially when your stomach is empty. They are a common digestive problem affecting millions of people worldwide, regardless of age or gender. Medically, they are known as peptic ulcers. These ulcers can occur in the stomach or the upper part of the small intestine. Peptic ulcers are open sores in the lining of the stomach or the first part of the small intestine, the duodenum. They can vary in size and severity. These ulcers occur when the protective mucus layer that lines the stomach and duodenum is weakened or damaged, allowing stomach acid to irritate the sensitive tissues beneath. This can result from various factors, including infection and medication. The stomach produces a strong acid, hydrochloric acid, to digest food. This acid is essential for breaking down food particles. This acid is usually harmless because the stomach lining has a protective mucus layer. This layer acts as a barrier to prevent the acid from causing harm. However, when this mucus layer is compromised, the acid can damage the stomach lining, leading to an ulcer. This damage can cause pain and discomfort. Understanding the causes and symptoms of stomach ulcers is crucial for prevention and treatment. Early diagnosis and proper management can help alleviate symptoms and prevent complications. Peptic ulcers are broadly categorized into two main types, depending on their location: gastric ulcers and duodenal ulcers. Gastric ulcers, as the name suggests, occur within the stomach. They are often associated with factors that decrease the stomach's protective mechanisms, such as reduced mucus production or impaired blood flow to the stomach lining. Duodenal ulcers, on the other hand, develop in the duodenum, the first part of the small intestine that connects to the stomach. Duodenal ulcers are more common than gastric ulcers and are often linked to excessive acid production or factors that delay stomach emptying, leading to prolonged acid exposure in the duodenum. Stomach ulcers often manifest with a range of noticeable symptoms, serving as warning signs that should not be ignored. One of the most prevalent symptoms is a burning pain in the stomach, typically occurring between the breastbone and the navel. This pain may worsen on an empty stomach or at night, and can be temporarily relieved by eating or taking antacids. Other common symptoms include bloating, a feeling of fullness or indigestion, nausea, and vomiting. In some cases, ulcers can cause more severe symptoms, such as dark or black stools, which indicate bleeding in the digestive tract, vomiting blood, or sharp, sudden, and severe stomach pain that warrants immediate medical attention. Section 4. Unraveling the culprits, causes, and risk factors of ulcers. The development of stomach ulcers is primarily attributed to two main culprits: Helicobacter pylori infection and the use of non-steroidal anti-inflammatory drugs, or NSAIDs. These factors disrupt the delicate balance of the stomach's environment, leading to the formation of painful sores. Helicobacter pylori, often referred to as H. pylori, is a type of bacteria that can infect the stomach lining. This bacterium is quite resilient and can survive the acidic environment of the stomach. It weakens the protective mucus layer, making it vulnerable to acid damage. Over time, this can lead to the development of ulcers, causing significant discomfort and potential complications. This infection is often acquired during childhood and is more common in developing countries. Poor sanitation and crowded living conditions can increase the risk of H. pylori transmission. NSAIDs, such as ibuprofen, aspirin, and naproxen, are commonly used to relieve pain and inflammation. While effective, these medications can have adverse effects on the stomach lining. However, long-term use of these medications can irritate the stomach lining, reduce mucus production, and increase the risk of ulcer formation. It's important to use these drugs cautiously and under medical supervision. Other risk factors that can contribute to ulcer development include smoking, excessive alcohol consumption, stress, and a diet low in fruits and vegetables. Maintaining a healthy lifestyle can help mitigate these risks and promote better digestive health. Section 5. Shielding your stomach: effective prevention strategies. Preventing stomach ulcers involves adopting healthy lifestyle habits and being mindful of potential risk factors. This means making conscious choices every day to support your digestive health. One of the most effective preventive measures is to practice good hygiene, such as frequent hand washing, especially before meals, to reduce the risk of H. pylori infection. This simple habit can make a significant difference. Limiting the use of NSAIDs is also crucial. These medications can irritate the stomach lining, so it's important to use them sparingly. If NSAIDs are necessary, they should be taken with food or as directed by a healthcare professional. This can help minimize their impact on your stomach. Maintaining a healthy weight, eating a balanced diet rich in fruits, vegetables, and whole grains is essential. These foods provide the nutrients your body needs to repair and protect the stomach lining, and avoiding smoking and excessive alcohol consumption can further protect the stomach lining. Both smoking and alcohol can weaken the stomach's defenses. Managing stress through relaxation techniques such as yoga, meditation is also beneficial. Stress can exacerbate stomach issues, so finding ways to relax is important. Or deep breathing exercises can also contribute to a healthier stomach environment. Incorporating these practices into your daily routine can help maintain overall digestive health. Section 6. Navigating the healing journey. Care tips for ulcer management. For individuals diagnosed with stomach ulcers, proper care and management are essential for healing and preventing recurrence. Following the prescribed treatment plan provided by a healthcare professional is paramount. This typically involves a combination of medications to reduce stomach acid production, eradicate H. pylori infection if present, and relieve pain. Lifestyle modifications, such as avoiding trigger foods that worsen symptoms, eating smaller, more frequent meals, and managing stress, are also crucial for ulcer healing. It's important to avoid smoking and limit alcohol consumption, as these habits can hinder the healing process and increase the risk of complications. Section 7. Embracing a future free from ulcers. A positive outlook. Living with stomach ulcers can be challenging, but with proper management and a proactive approach to health, a future free from ulcers is attainable for most individuals. By understanding the causes, recognizing the symptoms, and adopting preventive measures, individuals can significantly reduce their risk of developing ulcers. For those already diagnosed, adhering to medical advice, making necessary lifestyle changes, and seeking support when needed can promote healing, prevent recurrence, and improve overall quality of life. Remember, a healthy stomach is within reach, and embracing healthy habits is the key to a future free from the discomfort of ulcers.